The importance of screening for microalbumin to decrease CKD or SRD in patients with diabetes and hypertension, a primary care perspective. Chronic kidney disease, or CKD, is defined as a gradual loss of kidney function over time. It's classified into 5 stages, with stage 1 being mild damage and stage 5 being end-stage renal disease, or ESRD. The impact on health can lead to cardiovascular disease, anemia, bone disease, and increased mortality. Severe renal disease, or SRD, is defined as including advanced stages of CKD as well as ESRD, where dialysis or kidney transplantation may be necessary. The progression can occur rapidly for SRD if not managed properly, leading to significant health issues and decreased quality of life. Diabetes is the #1 leading cause of kidney disease. The mechanism of action which leads to kidney damage involves hyperglycemia, which causes damage to blood vessels in the kidneys as well as the nephrons. This inadvertently leads to nephropathy. Diabetes can also cause the kidneys to scar, which can lead to salt and water retention, resulting in increases in patients' blood pressure. Increased risks for diabetes patients include higher risk for CKD as well as SRD due to the persistent hyperglycemia and associated hypertension involved with this disease process. Hypertension is the second leading cause of kidney disease. The effects on kidney function involve high blood pressure, which causes damage to the blood vessels in the kidneys through narrowing and constricting them. This narrowing reduces blood flow and leads to impairment in the kidneys and restricts their ability to filter waste. Synergistic effects noticed with this disease process is seen when combined with diabetes, where an exacerbation of the kidney damage and an acceleration of CKD progression is identified. What is microalbumin? Microalbumin refers to low levels of albumin in the urine, detectable before more serious kidney damage occurs. Normal urine albumin levels are less than 30 milligrams per gram of creatinine. Microalbuminuria is defined as 30 to 300 milligrams per gram of creatinine, and levels above 300 milligrams per gram indicate overt proteinuria. Why does microalbumin matter? Microalbumin is an early marker as it indicates early kidney damage that can be detected before more serious symptoms occur. With early detection and also with the aid of certain medications proven to reduce microalbuminuria, patients can be spared from systemic vascular damage, which reflect underlying vascular damage that can impair many other organs. Who should be screened? With diabetes, all patients with type 1 diabetes after 5 years of diagnosis and all patients with type 2 diabetes at diagnosis. With hypertension, patients with high blood pressure and especially those with diabetes should be screened for microalbumin. The frequency of screening with patients with diabetes should occur annually, and for patients with hypertension, screening should occur annually or more frequently if results are abnormal. Testing options. The best test to screen for microalbumin depends on the situation, but the albumin to creatinine ratio, or the ACR, is often the preferred method in the primary care setting. The 24-hour urine collection, however, is the gold standard test for microalbuminuria, but it's labor-intensive, and a special container is provided or necessary to collect all urine over a 24-hour period. Benefits of microalbumin screening. Early detection through identifying kidney damage. Providers can detect damage at an early stage when interventions can be more effective. Prevention strategies. Through implementing potential interventions such as lifestyle modification, blood sugar control, and antihypertensive treatments like ACEs and ARBs. The ultimate goal of screening is improved patient outcome. This is done by reducing the risk through decreasing the likelihood of progression to ESRD and associated complications, as well as enhance quality of life through helping patients maintain kidney function and their overall health. Implementation can be done in a number of ways. A. Integrating screening into routine care. This is done by promoting routine checkup. This would include microalbumin testing as part of regular monitoring for patients with diabetes and hypertension. B. Patient education. The importance of adherence should be explained, as well as the benefits of screening and early interventions to patients. Also, providers should provide clear explanations of test results and recommended next steps. C. Follow-up care. Providers would be tasked with developing and implementing treatment plans based on screening results, including lifestyle changes and medications as needed. Medications for diabetes management include SGLT inhibitors, with examples being epagliflozin and canagliflozin. These drugs lower blood glucose levels by increasing glucose excretion in the urine, also reducing blood pressure and albuminuria. The benefits of these drugs are to provide cardiovascular and renal protection, especially in diabetic patients with CKD. Another drug class are GLP-1 receptor agonists, with examples being liraglutide and semaglutide. These drugs improve glycemic control and may have modest blood pressure lowering effects. The benefits of these drugs can reduce albuminuria and slow the progression of kidney damage. Medications for hypertension management. Angiotensin converting enzymes inhibitor, or ACEs. Examples include lisinopril or enalapril. These drugs reduce blood pressure and provide renal protection by decreasing intraglomerular pressure and reducing albuminuria. The benefits of these drugs slow progression of diabetic nephropathy and improve kidney function. Angiotensin II receptor blockers, or ARBs. Examples of these drugs include losartan and valsartan. These drugs block the effects of angiotensin II, reducing blood pressure and protecting kidneys by decreasing albuminuria. The benefits of these drugs are similar to ACE inhibitors, with a potential lowering risk of cough as a side effect. Calcium channel blockers, with examples being amlodipine or diltiazem. These drugs relax blood vessels and lower blood pressure, which can reduce kidney strain. Benefits of these drugs help to control blood pressure, potentially reducing the progression of kidney disease. Beta blockers, with examples being metoprolol and atenolol. These drugs lower blood pressure and reduce strain on the heart and kidneys. The benefits of these drugs are useful in managing hypertension and associated cardiovascular risks. Diuretics, with examples being hydrochlorothiazide and furosemide. These drugs help to reduce fluid buildup and lower blood pressure. The benefits of these drugs are effective in management of hypertension and can be used in conjunction with other antihypertensives. Aldosterone antagonists, with examples being spironolactone and eplerenone. These drugs block the effects of aldosterone to reduce blood pressure and proteinuria. The benefits of these drugs provide renal protection and can be beneficial in conditions like diabetic nephropathy. Challenges and solutions identified in implementing a renal protocol. Common challenges include limited awareness among patients and providers and logistical issues in implementing routine screening and timely prescription of effective medications known to decrease microalbuminuria and reduce the progression and prognosis of chronic kidney disease. Strategies for overcoming said barriers. This would involve education given to healthcare providers about the importance of screening and interpreting microalbuminuria test results. Providers should also be informed that medications like ACE inhibitors, ARBs, SGLT2 inhibitors, and GLP-1 receptor agonists are crucial for managing diabetes and hypertension while providing renal protection. Facilities could also utilize electronic health records to prompt screening reminders to providers to track results for patients with hypertension and diabetes. References from American Diabetes Association, American Heart Association, Mayo Clinic, and the National Kidney Foundation. This concludes this audiovisual presentation. Thank you for listening.